Me this morning, as I mentioned, to talk about this new Metabolic and Bariatric Institute at San Juan Regional Medical Center. Meghan Ritz is here. Good morning, and thank you for coming in this morning. Good to have you here.
Hi, good morning.
Also joining us this morning, Dr. Philip Ernest is here as well this morning. Dr. Ernest, good morning to you.
Great. Thanks for having me.
You bet. Good morning to both of you. It's great to have you here. And let's begin by talking a bit about what this institute is and what it's going to be doing when it opens maybe later on in just a couple of months. You were telling me before we came on the air this morning. Dr. Ernest, let me start with you.
Sure. So years ago, we had looked at the prospect of starting a program where we can help work with patients' obesity and with a goal of weight loss and counteracting some of the associated disease processes with obesity. And unfortunately, COVID hit, and that put everything that halted all of our projects. And now, about a year ago, we started looking at resurrecting everything and bringing it back to life. And we're now here, and probably it looks like beginning of June is when we'll be starting this project and opening our doors and accepting patients at that time. And so it's actually been really fortunate that we waited, because we have Meghan Ritz, who has come alongside to help assist in the program. She's the assistant director for the program, so we're excited to be able to have her come a part of the program. And so, yeah, we're excited about everything we're going to do.
Very good. Well, congratulations. And so you will be dealing with a lot of the surgical side of maybe whatever your patients will need, right?
Sure. So I'm the director of the program. I will be overseeing the program in general. And so there are two kind of pathways through the program. There's the surgical and the medical, and they both complement each other. So what we want to do is really make sure that patients have a pathway to weight loss that meets their goals. And that way, if they don't want surgery, we're able to assist in another way. And even if they've had surgery or have surgery and they're still not meeting their goals, we have the medical side to continue to assist. So we wanted the program to really complement each other with the surgical and medical modality. And so that was the goal when we started this.
Right. And I guess for patients too, right? Because maybe you have patients that maybe do not want a surgical solution at first, or maybe they want to try something else, and there's that path for them at first as well, perhaps, right?
Sure. Yeah. I mean, I think that, for some people, surgery can be very scary and intimidating, and it should be. It is a surgery. But I think that for them, we have the medical side, and sometimes people just need that time to work with our program and to work with other people, and then decide that, okay, I feel comfortable now being in this program, knowing everybody, knowing that I'm supported, to be able to make that step into surgery. The risks of surgery are very low. Particularly what we're going to be starting with is a sleeve gastrectomy. The risk profile of this surgery is extremely low. The data would say, it's less than 2% risk of a complication, and those risks are extremely, people tolerate them very well. That we have ways to treat the risk of some of these of the surgery if there is a complication, and most of the time the complications are very minor.
Got it. And the benefits, as you were telling me before, are pretty impressive, and we'll talk more about that in just a moment. But let me turn to Meghan Ritz for just a moment about your part in this new institute, and from the medical side, what types of things you can offer some of the patients that will be coming in to talk with you about maybe weight loss and how that affects a lot of other health issues too for folks, correct?
Yes. So the medical side will be more managing weight loss with pharmacotherapy or medical treatment, medications. We have a lot of really exciting new medications coming down the pike and already on the market that can be used to treat obesity and help patients lose significant amounts of weight. But the other really nice part about the medical management is we really help patients with their lifestyle and behavioral changes. And those can be some of the more challenging parts of any weight loss program or any weight loss effort. And so, as Dr. Ernest was saying, for patients that don't really feel like they're ready for surgery, they can certainly be managed on the medical side and start working on some of those really big lifestyle changes and work on those changes in an environment where they have a lot of support and a lot of accompaniment and accountability, which is sometimes the most beneficial part of that medical treatment for patients.
Right. And we were talking too before we came on the air. That's a big lifestyle change for a lot of folks, right? Especially for folks maybe who've been overweight or obese for a long time, and those habits maybe that they've developed over decades or what have you are maybe harder to change without support.
Absolutely. I mean, I think we've all had our own experiences where we try to adopt a new habit or make some kind of change. It's very hard. And so having that support and having resources and feeling empowered can be really an important part of the process for patients.
Right. And to have the two of you working together at this, I mean, again, there's a patient that each patient is unique and different, of course, but maybe some may go to one or the other or both of you, right, to reach their goals. Is that how it's designed, the program?
Yeah, so I'll be seeing patients as they come down through the bariatric side or the surgical side, working with pre-op clearance, really making sure that any medical conditions are optimized. And then for some patients who might need to lose more weight prior to surgery, they can certainly go down the medical side for the treatment plan, or even after surgery for patients that might not achieve their goals of weight loss. They can then come see the medical side, come see me as well, and get further support there.
Got you. Very good. Dr. Ernest, I'm going to come back to you to explain a bit about this surgical procedure that you were telling me about too. And I asked you if it was similar to the band surgery that we sometimes hear about for stomachs and things like that, and you were telling me that's not really in favor anymore. This is a better maybe option for many folks.
Sure. So the band, or the gastric band, was basically a band around the top of the stomach to shrink the initial pouch size of the stomach. And it did work, but it is something that needs to be continually managed because there's a filling of fluid inside the band to kind of decrease the size of the stomach, or allow more food to move through the band into the larger portion of the stomach. But over the past maybe 5 or 10 years, that's really fallen out of favor. There's not many institutions that really provide that surgery anymore. And most people with a band have been, or many people with a band have been, transferred over to a sleeve gastrectomy or room-wide gastric bypass or other bariatric surgeries. Now, the band did work. People did lose weight with it. But what we have found is that the sleeve gastrectomy provides a very robust weight loss. And so the estimated weight loss that you would have with a sleeve gastrectomy is around 60% of your excess weight. And so the easiest way to think of it, if you weigh 240 pounds, your ideal weight, or what you should weigh, is 140 pounds. Well, with a sleeve gastrectomy, you would lose about 60 pounds. And in some studies, it's even up to 70 or 75, percent. So 75 pounds, bring you down to that, 150, 160 pounds. So the band does not have that robust of a weight loss. There's other huge benefits too to sleeve gastrectomy because it has other effects where it can, resolve diabetes in about 60% of the population. 50% of the population can have resolution of their high blood pressure and also dyslipidemia. So, and these are kind of averages. I mean, some people have better success, and there's a lot of different data out there, but overall, these are kind of the averages.
Sure, of course. And each patient is different.
Yes.
Which we understand. And that's understandable. And this procedure, then, you're still, though, dealing with the stomach, right? This
Yes.
procedure is still reshaping or working with the stomach in the patient.
Yeah, thank you. So the band just shrinks the kind of top size of the stomach. It decreases the amount of food that can go into the stomach initially, and then it goes through the band into the larger portion of the stomach. For a sleeve gastrectomy, if you think of the stomach like a pouch, we cut off the pouch portion and tubularize the stomach, and so it decreases the overall size of the stomach, and so that is where you get that significant weight loss. We consider it a restrictive procedure because it restricts the volume of food that you can put into the stomach.
Got it. And this is the type of thing you'll be doing at the institute once you're up and running.
Yeah,
right?
yeah. And so
with consultation and helping the patient and seeing where they are and what their goals are, I guess, for their weight loss.
Yeah. So the program, no matter which way you go in our program, you're in the program for we're there to provide care for a patient for the longevity here. We're looking at the picture, not a short fix. It's not a take one pill and we've solved the problem. For bariatric surgery, if you're looking at the surgery part, we want to be seeing patients really out through 5 years and tracking the data, making sure that they're having a good result, they're meeting the goals, and that way we can assist and continue to make sure that they're continue to lose the weight and having the weight loss that they desire.
Got it. Very good. And we talked a bit too about the problem of obesity in this country, and it really is obesity. It's not just a patient who's maybe 20 pounds overweight or wherever they like to be, right? We're talking really heavier than they should be, an unhealthy weight.
Yeah, so obesity is really related to body mass index. This is not a perfect score or data point for obesity, but it's the best that we have because we can really associate a lot of risks to where people fall in obesity. And so you have your normal weight line, which would be like 20 to 25 for a BMI, and that body mass index is your height versus your waist. It's an equation that uses those two numbers. You're overweight when you're 25 to 30, and then at 30, you hit class 1 obesity. 35 or greater is class 2, and then class 3 is 40 or more. And so historically, we've done surgery for people that have class 2 obesity with comorbidities, so medical problems associated with obesity. And those are the people that would initially meet bariatric surgery. Now, there's been some big changes. In about October of last year, the American Society of Metabolic and Bariatric Surgery came out with a new set of guidelines, and the new guidelines say that really we should be looking at patients with class 1 obesity. And the thought process is that if you intervene on obesity sooner rather than later, you actually have better results. And that's the same with any disease process.
Sure,
if you
right.
think about high blood pressure or coronary artery disease or lung disease, the sooner you start treating it, the better the outcome is. And really, we're treating obesity as a chronic disease. It's not just a problem. We're really looking at it as something that affects everything else, and it does. I mean, that's all what the data shows.
Right, very true. And Meghan Ritz, let me come back to you a little bit about the same thing for your side of the treatment here. Does that still apply to you too, these levels of obesity? Is that when you get involved as well, or can someone come who maybe would like to drop a few pounds and maybe they're not typically obese? What would you say?
Sure. So obesity certainly is a chronic disease, and I think that's an important piece of information to highlight. Just like we have chronic disease like diabetes or high blood pressure, patients are followed throughout the courses of their life. It's not take this medication, we'll treat you for the high blood pressure, 3 months out, you're fine. Obesity is something that is chronic and relapsing, and so it is important that patients do seek care and get into either primary care or metabolic health care for treating obesity. And so for the medication management side of treatment, patients within a BMI of 27 with comorbidities are eligible for treatment with medications, and then anyone who has a BMI of 30 or higher can certainly meet the criteria for treatment with medication.
Got it. Very good. Thank you very much. And so for folks who are listening to us this morning, when you're planning to open, as you mentioned, maybe around the June timeframe is what the plan is. How can they come and see? Do they need a referral, or can they call and make an appointment, or what would you recommend?
Sure. So initially, we're going to be taking only referrals, preferably from primary care providers, but it can be anyone any physician or advanced practice provider in the community can refer to our practice. Part of the reason for the initial referrals is that for our bariatric surgery side, we will be only accepting certain insurances that are willing to work with the program initially. We will be expanding that as we grow, but that way we're not having people walk up and find out that we're not currently taking their insurance. And so there will be some restrictions. It will just also help us to know who their primary provider is. We want to be able to work with the primary care providers in our community in the Four Corners region to make sure that the patients are getting complete care and that the goals are not just between us, but it's also with their primary care provider as well.
Got it. And that seems like it's a fairly typical scenario with any new service line coming on with medical care or whatever is you've got to have those insurance folks lined up and all those agreements signed and whatever. I don't even want to think about it. But that's what you have to do, right?
Absolutely, yeah. Insurance kind of dictates a lot of the care that we provide. Whether you like that or not, it is just the system that it is in. So we're doing our best to work with insurance companies to make sure that we can provide the care that patients need.
Right. And you were setting this up, as you mentioned, too, for a lot of follow-up care as well. It's not just a one-and-done type of thing. You want to stay connected to these patients and see how they're doing, and if they maybe come to you for surgery, but then maybe they need some medical interventions as well as they move forward. This is kind of built into the way this program is set up.
Absolutely.
Gotcha,
Yeah,
Megan. Go ahead.
Patients will, when they come to the surgical side, even they'll see me, and I will follow with patients pre-operatively, post-operatively, and then also we're really using a multidisciplinary approach. We have a dietitian who's going to be dedicated to our program, which is really a huge benefit for our patients. So they might even meet with dietitians if they're having some more issues with meeting their nutrition requirements before and after surgery. Hopefully we can also expand and help offer physical therapy or other ways to help patients get more physical activity. So it really is just a team effort with surgeon, physician assistant, working with primary care providers as another way to make sure that they're in the loop, and they can also continue to offer support for patients even outside of the Metabolic and Bariatric Institute. So all these touch points are really, really helpful for patients and for outcomes.
Right, and really make a big difference too, I would say too, with these patients. And Dr. Ernest, you were mentioning from the surgery, if someone could lose 60% of their overweightness, that can really be a life-changing situation for these folks who maybe couldn't walk from the car to the store easily, or walk the mall, or walk to wherever. That's a big change, and that then maybe can spur some other better health choices for these individuals if they now can do these things without feeling like they need to sit down and just take a break.
Yeah, with bariatric surgery, we know that there's a huge benefit with the heart health as well, and so people see benefits. Yes, when you lose 50, 60, 70, 80 pounds, yes, that's a life changer. It allows you to do things that you were probably not entirely capable of or were very difficult before. But there's also benefits even just with your ability of your heart to be able to deliver the oxygen and blood that it needs to the end organs. So, people with congestive heart failure and coronary artery disease do see benefits with this. And for people that even have challenges with managing their diabetes, people that have really difficult time getting their blood sugars under control, this surgery can be a life changer for that as well. I mean, at that 60, while there's people that have 60% resolution of the disease of diabetes, the other 40% see a significant improvement in the ability to manage the diabetes. And so it's not just, it's resolved or not. It can be a life changer just with what you're using to manage your diabetes. So
right, and that's really important as well. As we mentioned, all these things are kind of interconnected, right? You get overweight, and that sometimes that starts causing other problems, even joint problems, I suppose, even with knees and hips and things like that, right?
Yeah, I mean, our orthopedic surgeons in the community are very excited about this because we know that joints do pay the price of obesity, and for people that are looking to get that total hip or knee replacement or any of those surgeries, oftentimes weight may be the restrictive piece to them being able to get that surgery. And so bariatric surgery can help them with the next steps in the process for their joint disease and other things like that. So yeah, there's lots of great downstream effects with surgery or metabolic treatment medically. I mean, we're all working for the same goal. We want people to be healthy and enjoy the life that they have.
Right. And Meghan Ritz, again, if someone is maybe trying to get surgery to correct some other problem, but they're overweight and maybe not an ideal candidate at the moment, they can maybe come to you for some assistance in dropping those pounds to get them ready for whatever other medical procedure they might need to improve their life?
Yes, definitely. My background is in primary care, and in the last 3 years, I've been working with obesity medicine and helping patients with weight loss. And this really is the highlight of my career, one of the most rewarding experiences that I've had, which is why I've decided to really dedicate my time to this, because it's rewarding for not only the clinician but also patients when they're able to start taking off medications, stopping the use of insulin to manage their diabetes, being able to be cleared for surgery to have a hernia repaired because, for years they've been told they need to lose X amount of weight in order to have that surgery done. So, the medical management of this also is just going to be really, really helpful for a lot of people.
Right. Very, very good. Well, it's a great new addition, I think, to what we have available here in the area. And I thank you for coming and talking with us. Dr. Ernest, I know you have to take off in a few minutes to go do a surgery today, so duty calls. But again, this is the Metabolic and Bariatric Institute at San Juan Regional Medical Center. And you're planning to open in June. You'll be located where?
So we are actually just moving our general surgery office, which is associated with the Metabolic and Bariatric Institute. And so we'll be at a new location, which will open up next week. If I had the address on the top of my head,
I'm sorry, I'm putting you on the spot.
So,
is it near the hospital campus, or is it somewhere else in town?
It is on the hospital campus.
Okay, so it's in that neighborhood.
It's right behind the cardiology building.
There you
go. It's the old oncology building.
I gotcha.
So,
okay, but that's where you will be.
Yes.
When the door opens. So
yeah, I wasn't prepared for that question.
I apologize. That's okay. Before I let you both go, though, is there any other advice maybe for folks who maybe aren't obese but just would like to drop a few pounds or anything like that maybe don't need your services yet, but if they don't maybe change their ways, they're on a path maybe to obesity, things along that line. What would you recommend, Meghan Ritz?
Oh gosh.
If I put Dr. Ernest on the spot, I got to put you on the spot too. Fair's fair.
I would say that really just looking at nutrition, going back to the basics. It doesn't have to be a fancy diet, a fad diet. Just really thinking about filling up the plate with healthy food options. And also finding a buddy, a family member, a friend, somebody to help with accountability and to make it fun. I think that's really an important part, is just making the change something that's going to be lasting and fun.
Got it. We always hear eat less, move more. Is that too simplified?
Way too simplified, but it's a great place to start.
Okay, that's some good advice. Wonderful.
I always, I'll just interject one little thing. I always tell all my patients just to really look at the sugar content. I think that, a lot of us, or a lot of people will, pick up the 2-liter bottle of soda and not think about all the sugar content in there. I think the amount of sugar that we put in our diet is one of the biggest downfalls and one of our biggest reasons we have an epidemic of obesity. And so just looking at that sugar content, whether it's beer, soda, those types of things really do add up quickly. And so if you can cut those things out or do low calorie or no calorie soda, beer, that kind of stuff, then I think you can see a big benefit just in cutting those things out.
Okay, there you go. Thank you both very much for coming in this morning and visiting with me about this new exciting institute to help folks who are obese and overweight. Really appreciate it.
Great. Thanks so much for having us.
You're very welcome.